Hello, my dear doctors. A warm welcome to all of you. This is Dr. Azam here, anatomy faculty at DocTutorials. And now, first of all, I hope your preparation is going very good. And within a couple of days, we are actually approaching to the day which we have been waiting from like years together, and which we have been actually preparing from many years. And you have been like rigorously preparing for that from the last 6 months. And now, first of all, to begin with, we have come up here. Why? Because yes, I know that you people are very busy with your preparation, very busy with your revision. So we just want you to remind all the important things that you have to do, like just before the exam, in the exam, during the break, everything in a crisp manner, in a brief manner. We want to just remind everything for you people here. So without any further ado, let's begin with this one. Let's see what are the things that we have to take care like before the exam and after the exam. So sir, to begin with, first of all, tell me, as a student, what do you think a student has to prepare himself like a night before the exam? Let's start from there.
Yes. Good evening, everyone. So, welcome to this session. Believe me, we're going to keep it very crisp and very productive in a way that you take home certain things which should be useful for you on the exam day.
Exactly.
So, what to do a night prior to the exam? For that, let us start from tonight. For example, we have like 2-3 days left now. So, guys, most important thing is please correct your sleep cycle. Nobody should be sleeping after 6 a.m., sir. As you know, that most of the activity would be happening between 7 a.m. to 5 p.m.
Exactly.
So this is a time when your brain, your body should be fully active. So in the remaining days, please practice that none of you should be sleeping after 6 a.m. So if you sleep at, for example, 11 and you get up at 5 o'clock in the morning, you had good amount of rest. So that's all about it. But you sleep at 12, then you get up at 6 o'clock in the morning. But I think that's the cutoff, number one. Number two is that night prior to the exam, people say have a sound sleep. And I always beg to differ on that. You know what? Because I recently appeared in MRCS examination and I remember a night prior to MRC examination, people kept saying, have a good sleep, have a good sleep. We don't get a good sleep a night prior to exam. If we are really seriously preparing for the examination,
Exactly.
on that night, there'll be a lot of, restlessness. There'll be certain, fears. There's, failure is, shining in front of us. And let us not run away from the reality, sir. So, what we want to tell you, number one, that this is the most natural thing to happen before any exam, howsoever prepared you may be. Exactly. So let us not really say, oh, I'm the only one anxious on the planet. Let me assure you, there'll be thousands of souls anxious on that night, just like yours, number one.
Exactly.
Then you need physical rest for sure. Guys, let us make one cutoff that after midnight on 3rd of June, we'll not study anything. Let's make a cutoff, rough cutoff, like, midnight is the cutoff, then we close the books, we lie down, and believe me, you'll be having a lot of anxiety on that day and you'll get some physical rest, and maybe around 2 o'clock or 3 o'clock in the morning, you get some sleep, and 6 o'clock you'll get up in the morning again. So the most important thing is, do not feel anxious at why the hell I'm not getting sleep actually.
Exactly.
So this has happened with everyone who has sincerely prepared for the examination. Take physical rest, number one. Get some amount of sleep. Do not worry. Next day, don't get the hangover. Oh, I could not sleep last night. Will my brain be working properly or not? Believe me, your brain will be secreting all possible hormones to keep you super active. So don't worry about that. But try to get as much sleep as possible.
Yes, sir. Yes, sir.
Third thing is, pray for yourself and pray for everyone.
That's
The theme of the whole thing is, the FMGs are very close to our hearts, and may every FMG pass the examination. That thing comes from within ourselves. And at the outset, may I tell you, Dr. Azam sir, me and every faculty who's working with FMGs only have one thing in their heart on that day: may you all pass. So let you also pray for yourself and for your friends also. May everyone pass. And one last thing, that please prepare the bag, whatever you want to take the next day with you. So Azam sir, I have a question to you.
yes, sir.
So we got up in the morning around 5 a.m. or 6 a.m. So getting ready. What should be your advice to our beloved students? What they should be doing on the morning of the examination?
Okay, sir. So once you have got what to do a night before the exam, तो चलो आगे बढ़ते हैं. Let's leave the morning of the exam. Now, first thing, the foremost thing I would like to tell you is that please get up on time. because that itself will actually reduce the anxiety. Suppose due to any reason, God forbids, ऐसा नहीं होना चाहिए, due to any reason, if you get late in the morning, getting up late in the morning, that itself will start creating the anxiety in your mind. So please make sure you get up on time in the morning, number one. And number two, make sure your transport and everything is like very ready. Everything, there should be no confusion in the transport, like how you're going to reach the hall. Please reach the examination hall on time. So, sir, I would like firmly tell these two things matters a lot in the morning time.
Very important, sir.
Very important things, reaching on time. And once you reach there on time, I'd like to tell you that what to carry and what not to carry to the examination hall. So number one, what to carry. There are only two important things that you have to carry. Keep it very clear in your mind. Number one, you have to have your admit card with your photo pasted onto that one. And number two, you have to have your ID original. Please mark my word there. It should be an original ID proof that you have to carry along with you. And in that, I would like to suggest you that, you carry your passport or you carry your driving license, because I actually had a, sir, chance to speak to a couple of students who have attempted the exam last time. And they told that when they carry Aadhaar card, along with Aadhaar card, they are asking some additional ID proof.
Yes.
So keep that point in mind. So whatever we get to hear from the students who have appeared, your seniors who have appeared the exam, we are telling you that experience, okay? So please, better you carry this one, these ID proofs, original ID proofs along with you. And sir, what do you think about like the students, uploading that thing in NB website? So should they carry like all the documents?
Yeah. The good thing would be whatever you have uploaded as a document to support your application, as identification proof or address proof, please carry all those original documents.
Better.
Original documents. Do not carry the mobile pictures of that. They do not accept that, and you may not have access to mobile at that point of time.
Exactly.
So I think let us keep it very sweet and simple. Whatever documents you have uploaded on your application,
Yes.
let us carry them.
That's
Keep one or two extra. If you have got a mail from NB that there's a controversy in your surname or your spellings of name, please carry one more document to support your candidature on that day. Because the idea, Azam sir, you would agree,
Yes, sir.
we do not want any one of our beloved students to have any amount of anxiety because of any other reason except exam.
Except the exam.
Exam. May every cell of yours work for the exam on that day. Let us keep it as at ease as possible, sir.
So making it simple, sir, as a student, if I'm going to the exam, I'll think that only two things I have to carry. One is admit card along with the original ID proof, sir. That's all. And yes, having said that, please mark my words that what not to carry is more important. Especially my boys, please don't wear the cap. No goggles allowed. Please don't wear a watch. No health bands allowed and all those things. No additional stuff.
And jewelry, sir?
Alright, sir, especially I'm coming to the point. Girls, please don't carry any sort of jewelry, or don't wear any sort of jewelry like your necklace or, like the bracelets, the earrings and the nose pins. Please don't carry. It has been clearly mentioned there. And actually, I'll tell you what will happen at the last moment. If you carry this one, at the last moment, they'll stop you from entering and they'll ask you to remove your watch, remove that earrings and all those things. And at that moment, you'll be having that hustle, sir, okay, where to keep this now safely. So in that way, what will happen, that will create a sort of anxiety. So I don't want that to happen. Please carry kya karna hai, sabko pata hai. Please keep think that what not to carry is also very much important, sir.
So one thing,
yes sir,
I would say most important thing to carry on that day is your confidence.
Exactly.
Please put it into your heart and soul that we're going to make it.
Exactly.
So carry the confidence on the day. That's the most important thing to carry on that day. You know that you have done your level best till the exam morning. You deserve to feel confident. So please do carry your confidence on that day, sir.
That is like golden words said by sir there. So chalo, like we have lived the last night, and yes, we got up in the morning on time, and I have reached the examination hall on time. Now please tell me, sir, I have heard somewhere, sir, from some of the students that Dhawan sir's funda of question A, B, C. Like what is that one, sir? I'm like very curious to know about that one.
Yeah.
How to approach this one, sir?
And students know it, but let me reiterate one more time actually before the exam. Guys, this is a game of 300 questions. And it always reminds me of the movie called 300, actually, one of my favorite movies. 300 questions would be having 3 different variety of questions. And let me tell you very openly, very honestly, that you would not be knowing the whole of the paper. But my humble question is the NB asking you to know whole of the paper to pass the exam?
Never.
No. The NB is asking you to just know half of a paper, 50% of the paper, to pass the exam. and you pass the exam.
50%.
So the same way they designed the paper in that manner. Can you recall any session in FMG history till now when people scored 290, 300 or 280? No?
No.
So scores have been 240s actually.
Max.
Correct me if I'm wrong. Max.
Yeah.
When I say 240, with due respect to those people and hats off to those people,
Exactly.
out of 240, 15 or 10 must be guesswork, sir. Guesswork, sir. You would agree?
Yeah,
So their
completely.
own marks were only 230, sir.
Completely.
So what I am trying to say, even the brightest of the students who scored the maximum marks in the history of FMG were not knowing 1/4 of the paper, sir.
Exactly.
Am I, sir? Would you agree with me?
Completely.
So out of 240, if 230 belongs to you, out 10 are guessworks. So it means that even the brightest of the soul on the planet in FMG segment was not knowing every fourth question of the paper, sir.
Exactly.
My dear friends, do you have the responsibility to know everything but everything to pass the exam? No. That's why the exam is also designed in such a way that nobody should know everything but everything. So type A question, type B question and type C question, sir. Type A question which you 100% know. And I would give an example of ENT anatomy together. The only abductor of the vocal cord is posterior cricoretinoid muscle, and we have been knowing it for time and ages now. And this is type A question, sir. Type A means that I know about it, 100% I know about it. Then there are type C question, which I do not know at all. At all means at all. For example, somebody says that Mondini's dysplasia of cochlea is related to which of the following syndromes? A. Hand-Schuller-Christian disease, B. Histiocytosis X, Mirard-Gobler syndrome, and then last eosinophilic granuloma. I don't know what is Mondini's. I don't know what is Mondini's dysplasia. I don't know all these four names which are given the choices. I do not know anything about these questions at all. This is type C question, guys. Let me tell you the reality. Every third question is going to fall into this segment, sir. My dear students, learn this. This will decrease the fibrillation in your heart when you attempt the paper.
Exactly.
Because if we know now that every third question is going to go off our head, still will comfortably pass the exam, then in the exam, our confidence would not go down. Because 200 questions still are on the other category. Out of that, and if 100 questions we do not know, even if you mark C, C, C in all 100, you score at least 10 marks in that also, sir.
Exactly.
So out of 200, we are going to score 140 and going to make the game happen. So my dear friend, it's not a game of being the best on that day. It's a game of playing the game best way on that day, sir.
Exactly.
So type C question are, unknown question to us. I always tell to students that whenever you see type C question, remember my face over there. I tell them, sir, like that.
Exactly.
You can remember Azam, sir. Remember our faces over there, that these guys told us that there will be approximately every third question will be like this category. Just give a broad smile, thinking about Azam sir face, and mark any beautiful choice coming to your mind, actually. But one suggestion I would like to say, if a completely unknown question comes, sir,
Yes.
and you don't have any idea about the question, about the choices at all, but two choices are pole apart, 180-degree opposite to each other. For example, somebody says that Pendant syndrome is autosomal dominant, autosomal recessive. Two choices are there. Third choice, and it has to be either dominant or recessive, sir.
Exactly.
If two choices in a perfectly unknown question are pole apart from each other, then answer lies out of these two choices only, sir.
Exactly.
We can make a smart guess over there. And we know because our chances of getting correct are 50% now, sir, rather than 25%. So I think we are smart, and FMGs are pretty smart, and may God bless you guys. You have stayed in a foreign country without any support, and you know what? That's what your brain is actually. So trust yourself, okay? Now type B question. Type B questions are where the approximately, 80-90 questions will fall in this category, where you know the story, but you don't know the exact answer. Your heart would be stuck up between two choices, B or C, A or D, and something like that. Now, you know what? There you have to go an inch forward from your current thought process. Current thought process. I'll just give an example of anatomy only because you are here.
Yes,
You know what? We have been doing that statement, time and again, all muscle or laryngeal supplied by recurrent nerve except cricothyroid. But the question came in the exam, which of the following laryngeal muscle is innervated by RLN from both sides? which of the following laryngeal muscle is innervated by recurrent laryngeal nerve from both sides? Now, this is a type B question. Why? Because my notes do not have this line. And I trust you guys, but I trust your common sense, I trust your acumen also. You know, in our whole notes, we have written one diagram and we written interarytenoid muscle is a midline muscle. It's an unpaired muscle. My brain will say, oh, it is unpaired, it's midline. This is the only muscle. Interarytenoid muscle is the only muscle which can take the R-line supply from both sides. So, my dear friends, I trust you.
Yeah.
Believe me, you are very able people, and trust yourself on the exam day. Evaluate the question. Oh, what he's asking. Oh, zero down to your choices. Then make a rational choice. Do not change the answer again and again, sir. I would like to, share this thing with you. A lot of time, even I felt in my MRC examination, I did the same mistake, to be very clear. I changed the answer of a couple of things, and the previous answer marked was correct one.
Yeah.
And last thing I would really like to say over here.
Believe your intent on that.
Yeah, absolutely, sir. Believe in yourself, because you know what, you know it actually, and you will have to go an extra mile over there. And every third question would be making you do little extra. It is exactly like what you're doing in the classes and the GTs and the mock tests are, as if you know swimming, swimming you do the width of the pool, na? At 4 feet you swim, but the exam is the length of the pool, beta. On that day, you go from 4 to the 12. If you're done swimming, you would relate to it.
Exactly.
If you are starting from 4 feet to go to 12 feet, you are going to, towards 12 feet, you're going to really put all your energy to hold the railing on the other side, sir.
Exactly.
And trust me, guys, you would be able to make it. Just remember, type A question, I would not do any silly mistakes. Type B question, I would evaluate. I would really go for the most rational answer. Do not mark rare answer for every question. Rare things are rarely asked. Common things are commonly asked. If you are confused between rare answer and a common answer, go for commoner answer. It's a screening examination, sir.
Exactly.
And type C question, remember our smiling faces and mark the most beautiful choice.
Exactly.
Azam sir, I've got a question for you.
Yes, sir.
Can you tell us that what are the various type of question asked in examination, sir?
Absolutely, sir. Absolutely. See, first of all, I would like to tell you, adding to whatever sir has told, like how to approach the exam, in that some of the student was asking in the comment section. I would like to tell you, okay, at the last moment, don't have that fear. I'm not able to recall everything, sir. This is one major, frequently asked question by the student. Sir, suddenly now, just 2 days before the exam, I'm not able to recall everything in the mind. See, even now I'm telling you, sir is sitting here. He has been teaching from years in ENT, and I have been teaching from many years the anatomy part. But at a time, as a human being, if we sit and recall ourselves, the entire subject, and any time will not recall.
Yeah, absolutely.
It's not with you as a human being. I'm telling you, normally, even though we are teaching the subject, if you sit here and think about the entire anatomy will not flash in front of my eyes. No. So exactly the same thing right now. All 19 subjects, if you just sit down and think, they're not flashing in front of my eyes. No, it'll never happen. But believe me, last 6 months you have put in your 100% effort, and whenever you see that particular question, subconsciously वो concept आपके mind में होता है. That concept will be definitely there, and that will strike in your mind. So sitting here, recalling the entire subject, and I am not able to recall, please don't do that mistake. Don't actually, make yourself like very uncomfortable with that one. That concept will be somehow there in your mind. The moment you see that question, 4 options, that will strike in your mind. And I hope that question has been answered to you. And yes, sir, coming to approaching the types of questions. See, in exams nowadays, what is happening in FMG exam, you're getting like one-liner, straightforward one-liner question and 4 options there, and that require proper concept and your straightforward marking. But be very careful in that one while marking. Read that words very carefully, like except, and on, all those things we'll be telling in the classes. Now most of the students are confused nowadays with the clinical questions, like how to approach. This is something new addition in the FMG, how to approach the clinical question. So, sir, I have told many students during my regular classes, and even in the DocTutorials videos and all, I have told them like how to approach the clinical questions. I want them to approach in a retrograde manner. Keep this word in your mind. You are going to approach in retrograde manner. You're not going to start the clinical question from the first line. A male aged about 30 years was driving a car. No. If you read that, a male aged about 30 years driving a car, and your mind will now start going in every book, whether it is a question from ortho, is it from anatomy, is it from ENT, is it from surgery. So no, that is not the right approach. For clinical question, please start from the options. You are going to start in a retrograde manner. Read the options. The moment you read the options there, sir,
Yeah.
Suppose the options are like, allopurinol, and the option is given there as xanthine oxidase. The option is given there as, glutathione reductase. The moment you read this, automatically, yes, yeah, these are the enzymes. That means the question is from biochemistry. So what will happen right now is that, okay, sir, out of 19 subjects, the thinking process, will narrow down to one subject.
Yes.
This is from biochemistry. Now suddenly then, now after that, what you're going to do is read the last line. Okay, they'll be asking you like directly. Sometimes what will happen, even though 3-4 lines are given, it's all just expanded form of one liner only. It will be just like a one liner. You read the last line, you'll get the option, mark that, and you can go ahead. But still in the last line, if you're not getting any clue in that one, then go for the complete stem of the question, then read the complete question. So my emphasis right now, what I'm trying to convey to you people is that in the clinical question, you're always going to start in a retrograde manner, ulta manner.
Very good.
Okay. And saying that, sir, moving ahead now.
Wonderful.
Another important thing is that, sir, tell me like the general things, like most of the students will be asking, sir, how to do the time management, and whether should I attempt all the questions or should I leave any questions and all.
Yeah.
So what is your
Okay.
approach on that?
Wonderful what sir has really said, and I would totally say that out of 19 subjects, suddenly zoom into one subject, and that's a very, I would say it's a take-home message for all of us, that because once you start a statement, you don't know where it is being asked, and you rightly pointed, sir, it's a learning for me also. I would say that out of 19, suddenly you could focus, oh, it's biochemistry. You know what? Though it's not a very strong subject for me actually, but anyway, I'll try to handle it that way. So, guys, number one, I hope all of you are smiling right now. That's the idea of coming to meet you over here is to make sure that we make you believe that we're standing by your side. And that's the main, because you should not feel alone. FMGs are very close to our hearts actually, and you should not feel that you're standing alone over here, and we are understanding what kind of anxiety and uncertainty and fear of failure is shining in your brain, and we want to make sure that you understand that this is a natural phenomenon happening before exam with everyone. Only thing is, let us contain the anxiety. Let us convert this to productivity. I would say that let us make this thing productive, and let us accept that we are not the best, but we're going to play our game the best.
Exactly.
I repeat, let us say to ourselves, I'm not the best. It's okay. I don't want to be the best, but I'm going to play my game best on that day. That's all. I'm not going to do silly mistakes. Sir asked that, what is the approach for the exam? So guys, you open up the monitor on that day. Guys, please speak less on that day. Am I humble? You enter the hall, just stay quiet, and brain should be relaxed. You see the first question over there on the day, paper 1, question 1, and it might be a sudden bouncer over there. If you see type C question over there, just remember our faces. Give a broad smile that these guys told us, like it's going to happen like that. Just mark whatever beautiful choice comes to you. And go to the next question. Don't worry. There are 150 questions you're going to attempt in sequence. None of the question you're going to leave unattempted in the first sequence. Your paper is actually of 2 hours, 30 minutes, sir. 150 minutes, sir. But you know what? I'm just reducing it to each one of you to 125 minutes. I do not want that you should really take too much time to finish the paper, or at least let us negotiate better. Let us give 135 minutes. Last 15 minutes should not be your exam counted time. Let us make sure that we know our time finishes at 2 hours 15 minutes, and we're going to finish all the paper in sequence one by one. Type A question. I will not do any silly mistakes. I will not forget to read the word all are true except. Guys, this is very confusing. All are true except, false about, incorrect about, not true about convey same thing, which is a wrong statement. Let me simplify it for you, beta. All are true except, not true about, false about, incorrect about. All of the following, type of question indicate only one thing. Choose that statement which is incorrect for the above given problem. That's all.
Yes.
So let's keep it simple, sir. We will not do silly mistake, my dear friends. The 120 questions can be scored very easily if you are just attentive in the paper. As sir said, it's not a subjective paper, my dear friends. Today I tell you, okay, tell me 10 causes of for example anosmia or smell problem or anything. You might be told one polyp, nasal polyp, and after that you're blank. But if I show you all are cause of anosmia except, suddenly brain say, oh, the sir said it's objective paper, beta.
Yeah.
So do not think that enumerating with your closed eyes is the right way of assessing yourself, beta. The paper will be objective. Something on the screen, let us match with the data over here. None of the question will leave unattempted. There will be certain question which will really take lot of time, sir. Lot of time. You know what? Complete story given of ICU setup and all that, and then they ask, is it metabolic alkalosis, respiratory acidosis, uncompensated metabolic alkalosis, or what not? And my brain is itchy. You know what? I'm thinking, but time is 1 minute plus. Mark the most probable answer, which is you are thinking at that moment. Flag that question. We'll come back to the last 15 minutes. From this moment onward, everyone, you should really condition yourself. My time is not 2 hour 30 minutes. My time is 2 hour 15 minutes. Beta. None of you should be using 15 minutes to do the last 20 question. Beta. There are few people who keep thinking about retrospective, prospective study, case control cohort study, alkalosis, acidosis, 2 minutes, 2.5 minutes, just keeps on going and going. What happened? Last 15, 20 question are left, and they are left with, 10 minutes, 12 minutes, 30, and in that, time we do silly mistake. Beta. So our time will finish at 2 hour 15 minutes. We will not leave any question unattempted. We will not take any question lightly, beta. Whatever the question which is looking like type A question should be taken as like easy question, but give respect to that. Like, okay, I'll check muscle, all accept, okay, fine, this one. Never go to that question again. It's a correct one actually. And one important thing, beta. Type C question don't need much time.
Yes, of course.
Because you don't know it. Don't know Montanus dysplasia of cochlea, my dear friends. So it's okay, no problem. You don't know it, leave it. It's just a 10-second job, sir.
Yeah.
Most beautiful choice, beta. Guess should not be thoughtful guess, beta.
Exactly.
Guess is a thoughtless guess, beta.
Yes.
A lot of people are praying for you. Your mother, your father, your brother, your sister, your friends. We all faculty members, beta. We all are praying for you. How our prayers will help you? Our prayers will make your guesses right on that day.
Exactly.
And if you put your thought into your guess, you are disturbing the nature's plan to help you. So please don't disturb the nature's plan on that day. Let it be the grace, flowing through you, beta. Just mark the most beautiful choice and go forward. If there is a polar part choice, one of those answers, that's all about. Type B question would be needing a little bit more time, and we'll really, go through that in a systematic manner. We'll finish it. Time management is very important. Our time is 2 hour 15 minutes, sir. That's the most important thing, sir.
Yes, sir. Yes, sir. And adding to that one, I think, as sir said, we are not going to leave any questions. Yes, sir. I think in FMG exam, keep one thing in mind: you don't have any negative marking. So when there is no negative marking, there is no fear of losing the marks and everything. So you're not going to leave any question. You are going to mark the answer till the 300th question. You're not going to stop till the 300th question. Now, sir, moving on, like how to approach the exam, we are done with that one. Now, I want to take the important thing towards the break time. Quickly, let us wind up right now, guys. Not taking much of your time. Last 5 minutes, we'll just wind up this one. In break time, I'll just tell you quickly 3 things to do. Number 1, in the break time, eat just some light food like sandwich or something like that. But eat that in the early part of the break. I mean to say, in between the paper 1 and paper 2, you're getting 1 hour of time. So don't keep that, just before the exam, just before the second paper, I'm going to eat. No, you are going to just immediately eat after completing your paper 1. That is first thing. And second thing, try to sit at either inside the vehicle if you're having that one, or try to sit at a comfortable place where you have good enough AC or something like that. Why? Because I don't want yourself to be drained on that day in the break time. If you get drained on that day on the break time, remember it's 4th June and it's very high time. It will be peak time of the summer, sir. And if you drain the energy, then paper 2 is still left out. Half of the paper is still left out. So I don't want that thing to happen. And third thing, keep in mind, please, as sir said, don't speak much on that day. And yes, it applies during the break time also. Don't discuss about the paper 1. जो आपने करना था, आपने कर दिया है. Whatever you have to do, you have done, and you have done your best. Keep that in your mind, and don't discuss anything about the paper 1 during the break time. So actually, Dr. Husamuddin was asking this question in the comment section. I hope that is answered, Husamuddin. These 3 things: eat in the early part of the time, don't drain yourself, don't speak much about that to anyone, guys. Yes, sir. So now, sir, can you just tell me, saying all these things, just to wrap up this thing, sir, how should I stay motivated through the entire period? Because it is not a small time, sir. It's taking my almost whole day.
Whole day.
Yeah.
Yes.
So how should I stay motivated throughout the exam, sir?
Yeah, absolutely.
Yes,
absolutely. It is a challenging day. Let's not run away from that, sir.
Exactly.
And as sir really beautifully described, a break time, guys. Paper 1 will scare you. Paper 1 will care for you. Paper 1 will scare you. Paper 2 will take care of you better. Don't worry. Paper 1 might be really giving you this jitters. So paper 1 did not go well, and you know how I have performed the paper. I do not know. In that hope, we go to different student groups and we start asking them, what did you write about that? For example, you ask a question to one group and standing outside the hall, and they said some answer which is not your answer. You will say, oh, my one question went wrong. Then you go to another group, ask them, what did you write about another question about that? Then they say another answer, and we always believe other people know more than us actually. We say, oh, their answer is correct, my two questions gone wrong. Now you're feeling low. Guys, let us pledge today. You are going to pledge me and Azam sir today one thing. Yes, between paper 1 and paper 2, we will not ask this question to anyone, how was the paper? How was the paper? A prohibited word, sir. We will not discuss any question at that point of time, guys. Paper 1 will scare you. Let me inform you already. But paper 2 will take care of you, sir.
Exactly.
Sir, I want to give an example. Even if paper 1 was horrible paper, God forbid, we scored 60 marks, God forbid. Don't you think so? We still stand a wonderful chance. In paper 2, we can perform well.
Of course.
And we score 90. And 90 plus 60 is we again pass the examination.
Exactly.
And you came under the pressure, oh, 60 marks, yaar, let's all, how will I pass? Paper 2 is coming, it's a clinical paper, you never know, 90 out of that and 60 plus 150 pass. So let us not assess ourselves, sir.
Exactly.
So I will give an example, sir. Yes. 2020 August paper was the disastrous paper in the history of FMGE examination. And I got many calls in the break time, sir, I don't want to go for the paper 2, sir. But may I remind my dear FMG friend, huge respect to all of you guys. In that toughest paper of medical science in this country, 14% FMG still pass examinations.
Exactly.
14% people still pass examinations. Those are people, they were not brainy than other people, but they were mentally strong more than other people actually. Exactly. That's what sir is asking. Exactly. How to stay motivated? We will not assess ourselves on that day before 5 p.m. 5 p.m. let the voting go on. You know what, counting happen after 5 p.m. They don't start counting immediately, na? Yeah. It's not that they vote for 1 hour, they count for 1 hour. After 5 p.m. voting, you know, we sit at aaj tak, kal tak, parso tak to really hear that analysis of the, you know, who won and all that. After 5 p.m. now, let us make a pledge today between us actually that we will not discuss the paper 1. Number 2, we will not predict any kind of result, good, bad, worse, first. We'll be a fighter on that day. We'll be a warrior on that day. A warrior, sir, doesn't mean that I have got all the power. A warrior means I know my weaknesses, but I'll play my game well. Exactly. That's all. A warrior doesn't mean that you have to all. Who says that your 19th study should be stronger? Yes, sir. Right now, students have got 2 things in their minds. One, my 12th studies are stronger. Okay. 4 are okay. And, you know, 3 are very, very bad. You know what? Not test that. Guys, if you're feeling like this right now, 12 studies are good, 4 are moderate, 3 are horrible. It is the perfect path to pass exams, sir. Yes. In this feeling of imperfect preparation lies the perfect path to pass examination. Exactly. So do not worry, beta. If you are feeling like 12 plus 4 plus 3 kind of feeling, you are on the right path of passing. So do not assess yourself right now or till the 5 p.m. on that day, beta. And one thing, how to stay motivated till the last, you know, second of the examination is, let us keep on playing this game in such a way that I already know that I would not be knowing many questions in this examination. It's okay. You might get 1 question after every question which you do not know, or you might get a trail of 3 questions, 4 questions or 5 questions. Sometimes this happens, beta. In both papers, you would see that a trail of 3, 4 very difficult questions, beta. Because one examiner would be like that. He would set a very high level of question. Exactly. And you would find 3, 4, 5 questions in a sequence which you do not know. And you start losing your morale at that time. Do not lose your morale. Keep reminding yourself with this kind of feeling only, my seniors pass, my colleagues pass, my friends pass. If they could pass, I can also pass. Only thing is, I should not be having this feeling that I have to know everything about this paper. Keep reminding yourself that even if I do not know every 4th question of the paper, I'll become a topper, sir.
Bilkul, sir.
Even if I do not know every 3rd question of the paper, I'll become a top scorer, 200.
Exactly.
Even if I do not know half of paper, I'll comfortably pass the examination. May I say again, sir? Yeah. Even if you don't know 1/4 of the paper. You're the topper. 240. Even if you don't know 1/3 of the paper, you are top scorer. 190, 200, 180, they look so great on the scorecard, beta. Exactly. Even if you don't know half of the paper, beta, you are going to comfortably pass the exam. The only thing is, let us not do silly mistake. Let us not lose the momentum. Let us not lose the hope, beta. Exactly. The hope should remain alive till the last second of the examination. I'm going to make it. I'm going to make it. Don't worry. These guys told us paper is like that. Trails of question come, which actually make you feel derailed actually, beta. None of us will get derailed. You will remember this conversation, remember, and give a good smile. Like, these guys told us. These guys told us, oh, the question will be coming in the sequence. Like 4 or 5 questions. One examiner is very tough examiner. He will put 4 or 5 questions in a sequence which are very tough, and our hearts start feeling, oh, medicine is so tough. It's okay. Some examiners put all those questions in a very, like last time PSM questions. They were like that only. So guys, let us keep, very much hopeful till the last second is over. Exactly. Be a warrior, keep playing the game well. You know what? It's a pond full of mud. In this pond, there are 150 lotuses here and there. Don't look at the mud, look at the lotuses better. Exactly. Don't look, mud is the unknown or partially known question. The lotuses are very stronghold question better. Let us pick them up and put it to our 150 kitty and we'll pass the examination, sir.
Exactly. So those are the golden words said by the sir. So agar, I think that third thing is very much important, that will give you a lot of motivation. Even if I don't know half of the paper also, still I clear the exam, sir, because the only thing required is just a screening test. I have to just clear the exam. Yes. It's not a competitive exam where we have to get a good rank or something. So please keep that in mind. And the Guru Mantra for clearing your MCA exam is that, you don't have to know everything about every subject. You have to know something about every subject, and that will clear the exam. As sir said, it will be only the common things which will be asked. हर सब्जेक्ट के बारे में सब कुछ पता होना ज़रूरी नहीं है. ये लफ्ज़ अपने दिमाग में रख लो. हर सब्जेक्ट के बारे में हर चीज़ पता होना ज़रूरी नहीं है. हर सब्जेक्ट के बारे में कुछ चीज़ें अगर मुझे पता है तो I am going to clear the FMG exam. So saying these words, sir, let us just close up. Let us not take like much of your time. And God bless you all.
This is one question people have asked actually. What to revise in the break time, sir?
Yes, sir.
Guys, break time, please carry, like some one-liners or maybe, OBGY or surgery or whichever subject you think you can really, have comfortable. It's a 1 hour break, better 1 hour break, because after that you again stand in the line to really, go to the hall. So break is not very long. My purpose is when you read, you will not speak, sir. I'm not really concerned what you're reading, but you're not discussing with anyone. So maybe clinical subject like surgery and OBGY would be a definitely a better bet to really revise in that time actually.
Like important tables, I think they can go through the tables, which we normally tend to forget. And staging in the cancers and all those things. So those kind of things which you tend to forget, just aram se comfortably go through that one. I think that will be solving your thing in the break time.
Yes, absolutely, sir.
So saying all this, sir, we wish all of you best of luck for this one, and keep in mind that you have done a lot of hard work, and after doing all this hard work for 4 to 6 months rigorous intensive work, and I believe you people more than me, okay, yes, you are going to at least perform 50%. yaar, ye to hoga hi. And I believe ke sir, whoever students select MBBS as their career, definitely these are some blessed people, and they have some additional things in their mind कि ना वो लोग पक्का कर लेंगे. इतना मेहनत करने के बाद में 50% तो आराम से लोग परफॉर्म करेंगे.
Sir, I would like to say one thing about people who are repeating, sir. I know I can feel the pain of the repeater, like 1 time, 2 time, 3 time. Guys, tell it to yourself, I will not repeat the same mistake as I did last time. Beta. Repeater, I know, what, when we repeat an examination, we have a different kind of, burden on head. Let us, shed away this burden only on that day exam, like a fresh exam on that day. But don't carry this burden. What will happen if I do not clear this exam? I know this echoes within our heart actually. Can we really leave it and take the exam as 300 question? I'm going to score 150 out of that, in a very, like I would say, easy manner on that day. That okay, let me see. I'm not going to predict my failure or anything. I have read a lot. I'll not repeat the same mistake as I did last time. That's the only thing. And between the break, please do read clinical subject. As sir said, some tables, some surgery, some OBGY, something you do revise, and just stay quiet and go to the exam on that day.
Perfect, sir.
Okay.
So that's all, guys. Nice interacting with you people, and God bless you all. And whatever hard work you're doing, surely you are going to come out with the flying colors. And yes, me and Dhawan sir, both of us, want to see you next time, not across the camera, like sitting and attending our class next time, or not in the classroom. We don't want to see your presence again in our classes, whether it is online or offline. We want to see your faces, smiling faces on the photographs which are presented on the online. Yes, cleared with 200 plus. I want your faces over there on the brochures and on the banners. You have cleared the exam, not in the classroom again. So keeping that thing in mind, yes, guys, God bless you all.
Best wishes. Best wishes, everyone. And keep praying for yourself. Keep praying for your friends also.
Exactly.
May everyone pass.
May everyone pass.
Thank
God
you very
bless
much.
You. God bless you.
Thank you.
Thank you.